promote health information exchange across the state. So with these office hours, we're just taking a little time out of our day to talk to you about hot topics in health IT and the role that My Health and a health information exchange can play into some of those processes. So today we'll be talking about safer guides. Just a few objectives of what we'll go over today. We'll talk about the program requirements surrounding safer guides and what you'll need to do. We'll talk about reporting, so what you have to report, where you report that information, who the eligible participants are, so let you know if your organization is required to complete these safer guides or not. We'll talk about attestation and data submission. So again, the systems in which you'll report that information for promoting interoperability programs. We'll talk a little bit about the role of health information exchange and how that kind of fits into the safer guides topic. And then we'll also leave you with some resources after this, and we'll also send out the presentation just so you have that for reference as well. So what are safer guides? SAFER stands for Safety Assurance Factors for EHR Resilience. So these guides were developed by the Office of the National Coordinator for Health Information Technology, or more frequently referred to as the ONC. So these guides were actually developed back in, I think, 2014. So they've been around for quite a while. This was kind of right after the swing of everybody getting up and running on an EHR, kind of being required to do that for different Medicare programs when all the meaningful use buzz was about. So they've been around for a while, but they're more relevant here within the past couple of years because they've been tied into the promoting interoperability programs. And this year they're actually required. So we'll talk about that a little bit later. But these guides are a set of self-assessment tools that help healthcare organizations to evaluate their EHR safety practices, identify potential risks, and mitigate those risks. It's part of the Protect Patient Health Information objective within the Promoting Interoperability programs. So that Protect Patient Health Information objective, that is not data that you'll necessarily have to submit for this program. That is going to be a few different statements that you are attesting to at the beginning of that reporting procedure. So these safer guides will be tied in with your security risk analysis, with some data blocking statements. So these are all going to be a yes/no attestation that you do at the beginning of the program. Why this is important is if you don't attest to these statements, or you say, no, I haven't done a risk assessment, or no, I haven't completed the safer guides, then you don't qualify for that entire program. So there are penalties that are tied to that if you don't complete it, or if you don't do some of these things even before submitting some of your data. So these really are important just to make sure that you get a score and can get positive reimbursement through those different Medicare programs. These will tie in a lot to your security risk analysis, so you will see some overlap there. Remember, your security risk analysis is looking more at your organizational policies and procedures, what kind of administrative practices you have in place to support those, and also looking at your technical environment and your physical environment. So the risk analysis is really looking at your HIPAA security as a whole. These safer guides are looking more at EHR specific procedures. So again, you'll have some overlap there, but these are two different things that you'll have to complete. It would be helpful if you've already done your risk assessment as you're going through these safer guides to have that available. Again, just because there is overlap, just another way to make sure you kind of fill in the blanks and make sure you're getting all the information into these guides that you have available. So safer guides consist of 9 different guides total, and they're organized into 3 broad groups. So these 3 groups are foundational guides, infrastructure guides, and clinical process guides. A little bit later in the presentation, I'll talk about all 9 guides and what is included within those, but just wanted to give you an overview about how they're broken down. So again, these guides enable healthcare organizations to address EHR safety in a variety of different areas within these 3 groups. Typically, you'll want to start with the foundational guides. They'll kind of be the most generic, and then they'll get a little bit more in depth as you go through the infrastructure and clinical process guides. So who is required to attest? So requirements for this is through the Center for Medicare and Medicaid Services, CMS. Eligible hospitals and critical access hospitals that participate in the Promoting Interoperability Program will be required to attest. And then eligible clinicians that participate in MIPS or the Merit-Based Incentive Payment System will also be required to attest. This is part of that Promoting Interoperability section within MIPS. So with MIPS, your traditional MIPS, you've got the 4 categories: promoting interoperability, quality, improvement activities, and cost. So again, this ties into that PI section. If you do participate in an ACO or some type of advanced payment model, you will still be required to do these. For all of those advanced models, you still have to submit promoting interoperability to show that you're utilizing a certified EHR technology system. So these will be required whether you're doing that traditional MIPS or you're in one of those advanced APMs. So where do you attest this information? Eligible hospitals and CAHs will submit their information through the HQR system. So this used to be done through QualityNet. Just a couple years ago, CMS migrated everything over to that HQR system. So again, you'll have to do this to ensure you've met all the program requirements for the EHR reporting period. You'll also attest there with your ECQMs and everything else that is kind of combined within that Promoting Interoperability Program and through the HQR system. So hospitals do have to attest to completing all 9 SAFER guides. Eligible clinicians will attest their information through the QPP website, or you can have a third-party intermediary do it on your behalf. Again, this will tie in with your MIPS submission. So however you typically report that data, whether it's through the third party or whether you get onto that QPP website and plug the information in yourself, either one of those will work. Clinicians are only required to complete a minimum of 1, the high priority practices guide. You can do more than those, but you will just have to attest that you've completed at least the high priority practices guide. So hospitals will have to do all 9, clinicians just have to do at least that first one. So when do you have to attest this information? So for calendar year 2024, eligible hospitals will be required to attest yes to completing all 9 of the SAFER guides. This can be done at any point during the calendar year. So this year within those Promoting Interoperability programs, we do have a requirement of a 180-day reporting period. These guides, just like your risk analysis, can be done outside of that 180-day reporting period. It just needs to be completed within the calendar year. So your final day to complete the guides, so to have all 9 SAFER guides completed and saved somewhere securely in your systems, is December 31st. Hospitals will have until the end of February. That may be subject to change just depending on when those Promoting Interoperability programs, their actual final date is to submit. But you'll have typically until the end of February to get all of that information submitted within the HQR system. Clinicians will have until the end of March typically. So this again will tie in with your MIPS reporting deadline, but must be completed within calendar year 2024. And then you'll have at least 2, possibly 3 months, depending on your organization type, to get that information submitted to CMS after the first of the year. So why are you required to attest to these? What this is really looking at is creating a culture of safety within your organization and clinic. We'll, again, get into those specific guides and look at what they're doing. So it can protect you for EHR downtime. It can protect you from medication mess ups tied to your computerized physician order entry. So there's a lot of different things that these guides are looking at, but it's really trying to create that culture of safety within your organization. So if you test yes, that signifies that you as a participant have completed your annual self-assessment of the Safer Guides requirement. If you attest no, last year, so for 2023, you could attest no and you could get by with that. CMS was really just trying to get a feel for how many people were completing those guides. This year, if you attest no, you will fail for those promoting interoperability programs. So if you're a clinician, that means that you would not receive a score for that promoting interoperability part if you didn't complete these. So you would only get scored on quality, cost, and improvement programs. So that is going to leave a really big deficit if you don't complete that. And you would be subject to a downward payment adjustment. So clinicians, depending on how well you do in the MIPS program as a whole, can receive either a positive or negative 9% payment adjustment through Medicare reimbursement. So really important to make sure that you get at least that one guide done if you're a clinic, so that you don't take a hit there. Hospitals, if you attest no, it fails you for that entire promoting interoperability program. So this is also tied to payment adjustments on the hospital side. If you don't attest to promoting interoperability or you don't have enough points to satisfy the requirement this year, then if you're a PPS hospital, you would get a 2% reduction in whatever the increase to that IPPS rate is for the year. If you're a critical access hospital, then you would be reduced down to 100% of reasonable costs for that payment adjustment year. So whenever the reporting period is, so that calendar year, if you don't complete these programs, that payment adjustment kicks in 2 years later. So if you aren't able to do these or don't complete them for 2024, your payment adjustment would kick in 2026. So just something to be aware of, because last year you could get by with saying, no, we didn't do it, but we are aware of it. This year you have to complete those guides, or you'll be subject to that downward payment adjustment. So within each guide, they'll be broken down into 3 different domains. So the first domain is Safe Health IT. Second domain is using Health IT safely. And the third domain is monitoring safety. So each guide is going to have different questions that fall into each of these domains. And I'll show you an example here in just a minute. A multidisciplinary team should complete the self-assessment. I'll give you, I've got a few screenshots that show you what the guides actually look like. But each guide gives you a suggested source of input. So that could be clinicians, it could be hospital or clinic administrators, EHR developers, health IT support staff, just generic support staff within the clinic. So depending on if these questions fall in one of those clinical guides or if they're more technical, it's going to recommend that different personnel are available. So again, similar to your HIPAA security risk assessment, it is going to be a team effort that you need. It probably will be difficult for just one person to complete these guides. So you'll need input from various people within your organization to make sure that you're answering these questions accurately. So this is a screenshot of what your Safer Guides are going to look like. So all of these guides are on the Office of the National Coordinator's website. They are all in a downloadable PDF format. So what we recommend that you do is go ahead and download all of those Safer Guides to a shared server, a shared site that you have within your organization that's secure. So somewhere that just in case you are ever audited on this information by CMS, you can go back and have reference to those guides. We typically want it, again, in a shared location just because there could be multiple people working on it. And so you want that information to be secure and to be accessible to all of the team members that will be working on it. So once you go in and download all these guides, you can fill them out. They'll have little radio buttons, they'll have drop downs. And I'll kind of show you on the next couple of screens what that looks like. So each guide, once you go into it, this first one here is the high priority practices. So this is the one that clinics will be required to complete, and the first of the 9 that the hospitals are required to complete. So all of them will have general instructions. They'll have an intro, break down the checklist for you, have that team worksheet. So that again will show you who the suggested personnel within the organization are. It's going to have recommended practice worksheets, and then references as to why they're looking at this information or why this needs to be built into your safety of culture within your organization. So this is what the safer guides are going to look like. You're going to have a checklist at the beginning with all the questions, and you'll go through and designate for each standard whether it's fully implemented in areas, partially implemented in some areas, or not implemented. So I do want to mention here, it's required that you go through and complete either 1 if you're a clinic or 9 if you're a hospital, all of the safer guides. You will not be penalized if you go through the guides and in this first year you're saying, oh, we don't have this implemented, we don't have this implemented. So you're not graded on if you're fully implemented, not implemented. This is really just a self-assessment to see how you're currently doing in these areas. And then just like with your security risk analysis, you want to have a plan of action. So that plan of action is kind of built into these worksheets so that you can look at how you performed last year, make some recommendations of how you can improve, and then go through the next year and see what's changed and what you can maybe bump up to partially or to fully implemented. These do have links throughout here. So as you're going through the questions, you can answer all the questions first if you want to, whether you're fully or partially implemented, or you can answer the question and then click on the worksheet and go ahead and fill in your data, fill in your team members, that kind of stuff. It does, again, so as I mentioned, they're all broken down into different domains. So it will have your domain listed at the top, and then the questions within each domain are listed under that. So again, just looking at the checklist, you can go through here. And then, so just going back, so if you click on the worksheet, so say I'm on question 1.1, click on worksheet 1.1, it will take me to that specific worksheet. So all of these will tie back to those questions above. This implementation status, after you've clicked that radio button, it will pop up here, whether it's fully, partially, or not implemented. If you don't want to use the checklist, if you just want to go through these more detailed sheets, you can do that as well. And just do the status from here. So again, either place that you click, it will update that information for you. So within this, this gives you rationale for the practice or risk assessment. So what they're looking at and why they're looking at this specific information within the EHR and within your organization. It gives you examples of different useful scenarios or things that you can do within your system if you don't have that implemented yet. This also, as I mentioned, is kind of your plan of action. So it's going to give you assessment notes so you can make notes on what you maybe currently have in place, what processes are going on, any follow-up actions. So anything that you need to do to kind of get that bumped up to fully or partially implemented. And then the person that's responsible for that follow-up action. Up here is where it shows you that suggested source of input. So you may, if you're in charge of completing these for your organization, maybe pull up one of the guides, see who the suggested sources of input are for the different sections, and then make sure that you pulled those staff members into that meeting so you're not having to run around and ask a bunch of people different questions. You can get all that information there at one time. So I'll cover a little bit about each specific safer guide and what they're looking for. So we won't go through all of them, but that worksheet that I just showed you, that's what the downloadable PDF will look like. So once you've saved that to your computer, you can go in, save any changes, and then just save it on that secure or shared drive so that you can reference that in case of an audit. So these are the 9 total guides that you have within your 3 4 headings. So you have your foundational guides, and that includes high priority practices, which is the one that's required for clinics, and your organizational responsibilities. So those, again, are kind of your more generic ones that you'll typically want to start with. Then you have your infrastructure guides. So this looks at contingency planning, system configuration, and system interfaces. And then your clinical process guides. So this is going to be patient identification, that computerized provider order entry with decision support, test results reporting and follow-up, and clinical communication. So as I mentioned earlier, you can see we talked about creating that culture of safety. It's looking at a lot of different things within your EHR system. So looking at technical vulnerabilities and safety there, and then also safety on how you document information, how you share information, and making sure that those results and information that you've entered into your system are valid. So the high priority practices, this is going to identify high risk and high priority items within your EHR system. So it's recommended safety practices intended to optimize the safety and safe use of your EHRs as a whole. This high priority practices is that first sample guide that I showed you with the screenshots. Your organizational responsibilities, which is the second guide, is going to identify individual and organizational activities, processes, and tasks intended to optimize the safety and use of EHRs. So this is really breaking down who's responsible for what processes within your EHR system. And it's really important to make sure, again, that this doesn't fall on one person's shoulders. You want to make sure that you have segregation of duties, not just one person is responsible for everything. One, just because of burnout, we don't want to overload people, just because this can be time consuming if it's the first time that you fill them out. And two, you want to protect yourself in case an individual leaves your organization. So if one person was responsible for completing all this and maybe doing your risk assessment, it can kind of leave you high and dry if they leave and nobody else was involved in that process. So making sure that you've got those duties separated and it's really a team effort. The next section is your infrastructure guides. So there's 3 different guides within this subtopic. The first one is contingency planning. So this is going to identify recommended safety practices associated with planned or unplanned EHR unavailability. So looking at your EHR downtime procedures. System configuration identifies recommended safety practices associated with the way EHR and hardware and software are set up. So this one is going to be more technical, probably going to involve maybe your EHR developer, your IT team. So making sure those individuals are available for this. And then system interfaces. So identifies recommended safety practices intended to optimize the safety and use of system-to-system interfaces between EHR related software applications. So anything that your EHR is connecting to, whether it's a patient portal, whether it's the health information exchange, whether it's a third-party app that is pulling quality data out of your system, you want to look at all of those different interfaces that you have in place, make sure that they're secure, and make sure that that information that's being shared between the systems, again, is valid and running smoothly. So I do want to mention here on these infrastructure guides, the role of health information exchange. So these HIE office hours, we want to touch on some different hot topics in health IT, but we really want to intertwine that with what the HIE can do and how it plays a role. So HIE can play a role in your contingency planning and your downtime procedures. We actually have some use cases of this that systems that are already connected to My Health, the state designated entity for health information exchange, have actually fulfilled this role for organizations. So if your EHR systems go down, maybe just for a couple hours, or maybe you've been hit with a cyber ransomware attack, cybersecurity, that can be a big issue, and you could be down for days, weeks, maybe even months. If your EHR systems are down, but you still have access to the internet, if you're connected to that health information exchange, you can still access patient data. So you may not have that entire patient's record, but you could still get things like their medication list, their problem list, allergies, admission, discharge, and transfer information. So even though you are probably going to have paper processes in place if your EHR system goes down, if you've still got access to the internet and you're connected to an HIE, you can go in and at least pull some of this really pertinent information and be able to still treat patients instead of having to just shut your doors or start over from scratch. So it's really great to still have this information at your fingertips, even if your EHR is down. HIE will also be addressed within that system interfaces guide that we discussed. So that system interfaces guide looks at processes around clinical data exchange. So how are you sending data from your office to another healthcare provider? How are those referrals going electronically? So this again plays into other pieces within that promoting interoperability program. You have different health information exchange measures, so both the sending and receiving of data, and how that clinical information is moving between your organization and others. So if you're connected to the HIE, this again can be part of that process that you're going to want to include within these safer guides. Also looking at the management of clinical content, and then, as I've mentioned a couple of times, data validity. So whenever you are exchanging information with other healthcare entities, you want to make sure that that information is accurate, that it hasn't been changed in any way, and that those relevant pieces of information are getting to the people that they need to. So HIE can really be a valuable tool and play an important role in these processes as well. So getting back to the guides, the last section within these safer guides is your clinical process guides. So 4 different guides under this one. The first one is patient identification. It identifies recommended safety practices associated with the reliable identifications of patients within the EHR. This is really important. I actually worked for a small primary care office in rural Oklahoma way back in the day. We had a patient chart. The 2 patients had the same name and the same date of birth, just born in a different year. So that was something that most everybody in the clinic knew because they'd worked there so long. But whenever you'd have new employees, that was an easy one that if you got test results that came in on somebody, it could easily be attached to the wrong chart. So it's really important to make sure whenever you have that information coming into your system or whenever you're documenting, you're doing it on the right patient. So patient identification is a big safety issue within those EHR processes. Computerized provider order entry with decision support. So these were 2 things that were really a hot topic during those first days of meaningful use. So if you remember all the way back to stage 1 of meaningful use, CPOE and clinical decision support were 2 of those required objectives within the meaningful use program. So this is looking at recommended safety practices associated with that order entry, and then also clinical decision support tied to that order entry. So it's utilized to improve medication safety and also help with the communication loop for diagnostic tests and consultations. The clinical decision support can be really great. I know sometimes we can be overwhelmed by pop-ups, but when you're really looking at preventative care and kind of that continuity of care, you want those alerts whenever a patient hasn't completed a referral process that you sent, if they haven't filled a medication order, if they haven't had a colonoscopy or mammogram. This is also somewhere else that the HIE can help. Again, if you're connected, you can incorporate that data. You're not just looking at the data that is listed within your EHR system. You're able to access people from all over the state, possibly even outside the state, that have seen your patient and are contributing to their larger clinical chart. So just making sure, again, you have an accurate representation of the information within that individual patient's chart. Test results and reporting and follow-up. So this is going to identify recommended safety practices intended to optimize the safe use or processes in EHR technology for the electronic communication and management of diagnostic test results. So again, really important on the interface side. If you don't have an in-house lab, or if you do and it is connected to your EHR, making sure that those lab results are coded correctly, making sure that that information as it comes over from one system to another is accurate, is a really big patient safety issue. And then clinician communications. So this guide identifies recommended safety practices associated with communication between clinicians, and it's intended to optimize the safety and safe use of EHR. So again, that clinician communication, transition of care, when a patient is moving from provider to provider or different settings of care, looking at those practices that you have in place within your EHR to make sure that you're both sending the proper information, and that whenever they're referred back to you or coming to you for a follow-up, that you're reconciling and incorporating the relevant parts of that chart or that visit back within your EHR. So all the processes associated with that. So those are your 9 SAFER guides. Again, hospitals are going to be required to complete all 9 of these. Again, they can kind of be a little time consuming if you haven't completed them before. So if this is your first year of doing these guides, make sure that you've got that team in place and that you're setting aside sufficient time to get all these guides knocked out before December 31st. So again, need to be completed within the calendar year, but can be or fall outside of your EHR reporting period for the calendar year. These are a few different references and resources. So healthit.gov is the Office of the National Coordinator's website. So all of the guides are located on that site. If you just go in and Google SAFER guides or you click this link, they'll all pop up. We'll have links to each one. And again, we recommend going in, clicking it, downloading that PDF to your system or to your server, and then knocking those out as a team. If you're a hospital and have specific questions about where to report, maybe you're new to the facility and haven't accessed the HQR site, or not sure where within the site that you're going to report this information, you can reach out to the QualityNet support team. So that QNet support at cms.gov, and then that's their phone number. And then on the clinician side, same thing. If you have questions on what to report, where to report it, how to get access to the site, you can check with the QPP at cms.hhs.gov, or call that 866 number there, and they can give you more information. So that's what I have on SAFER guides. I do want to touch really quickly again on My Health and the Health Information Exchange. So right now we have the OK Shine Connection Fee Assistance Program is open. So our state legislature in 2023 passed a bill that basically enables us to be able to connect to the state designated entity for health information exchange, which is My Health. And they're going to pick up the costs associated with that. So they initially appropriated $30 million for these funds. What these funds will do is they will cover costs for your connection to My Health. So for My Health to build that interface and connect with your system so that you're able to bidirectionally exchange clinical data and content. The state has also recently agreed to pick up your costs if your EHR vendor on the other side is saying, well, you know, there's going to be some technical things we have to do. You know, it's going to be a couple $1,000s for us to complete this process. So within reason, the state is agreeing to pick up those funds on a case-by-case basis. So really all you would be responsible for after you get connected is that monthly fee just to keep that connection ongoing. And if you're a hospital, that's based on a couple of different factors. You can reach out to the OFMQ or the My Health team, and we could give you an estimate of what that would be. For providers, it's as low as $60 per provider per month, and that's just prescribing providers. So again, if you are interested in connecting to the HIE or think this may be something that you're wanting to do in the near future, the time to do it is right now. Because again, they will pick up your fees both on the My Health side and on the EHR side to get connected. The funding initially was only guaranteed through June of this year. The state legislature did approve to extend that. So it's currently available through June of 2025. So make sure that you get that connection fee application completed so that those grant dollars are assigned to your organization for whenever you're ready to begin that process. How do you do that? So applying for the connection fee assistance program, you can go just Google OK Shine or go to the Oklahoma Healthcare Authority's page. And under OK Shine, they'll have a lot of different information about health information exchange and the state designated entity. But you see this little piece down here. So the connection fee assistance, you can view a flyer that just gives you more information, or you can fill out the application. The first step in that process is making sure that you've completed an application to participate with My Health. So if you click on this link here, or if you click apply now, it's going to ask you if you've already registered to participate with My Health. If you say no, it'll automatically bump you over to My Health site to complete that. It's a really short application. Once you completed that My Health application, then you can go back in, complete that connection fee assistance form. And somebody from the OFMQ or My Health team will reach out to walk you through that process, get in contact with your EHR vendor, see what steps we need to do to get that clinical data flowing and get you in queue for that. So again, health information exchange is a really hot topic. It's kind of at the forefront. It's all intertwined within the SAFER guides, within the promoting interoperability programs. So it can be a really helpful tool for you to one, just get a more complete, accurate information about your patient population outside of the four walls of your clinic and get connected to that. And then it can also help you satisfy a lot of those different promoting interoperability requirements within that program as well. So the time to get connected is now. And that is all I have for today. So I hope we appreciate you all taking time out of your day to learn a little bit more about SAFER guides. We can open it up for questions. You can type those in the chat if you have any. And again, after this presentation, we'll send out the link or the slides to all the participants, and then you'll have those additional resources as well. You can also feel free to reach out to our team if you have any more specific questions about SAFER guides, about your HIPAA risk assessment, promoting interoperability programs, whatever it may be in health IT, we are happy to help.
I'm not seeing any questions so far. We did have one question if the slides will be sent out. So just wanted to reassure you that yes, I will be sending those out today. Other than that, it doesn't look like any questions are coming through.
Okay. Well, once again, we thank everybody for joining us.
Sorry, hold on one second.
You're good.
Blake, you have a question?
Are you able to take them off mute, or if not, there you go.
Here we go. On the first guide you said was for RHC. Does the hospital and RHC have to do them separate, or does one count for both facilities?
If you are shared on an EHR system, so if you use the same system on the hospital and the clinic, same IT services, everything like that, just completing one guide likely will be good for that. I would just make sure that within that assessment, you put some notes that you are addressing both the clinic and the hospital environment. I do want to mention too, so you said RHCs. I will say it's a great practice for everybody that's using an EHR system to make sure that they are aware of these guides and completing some of the information in there. Rural health clinics are not required to participate in promoting interoperability programs unless they are operating through an ACO or other advanced payment model. So that is something to be aware of. And again, if you have more specific questions about your eligibility, we can help out with that. Or you can look at the QPP lookup tool. You can type in your MPI number for your providers within your organization, and it will tell you there whether they're eligible or not to participate in that program. So if that does come up and say that you're eligible, make sure that you're getting at least that one safer guide done. But yes, I think these can be done, again, to answer your question, as an organization as a whole, especially if you've got a shared system. Now, if you were on two different EHR systems, you may want to look at doing two separate guides, or at least document within that high priority practices guide that you have two different systems and who's in charge of managing those processes.
All right, awesome. We do have one other question. Can you please discuss further what is needed from the EHRs and shared portals information connection?
So some of that will probably be addressed within some of the clinical process guides, and also in those interoperability guides. Within the patient portal, so you'll probably be looking at processes like what information you push to the patient portal. Are you sharing lab results? Are you sharing vaccination records? Are you allowing people to schedule appointments? So you'll just want to look at those processes and make sure you've got that documented within the safer guides and make sure that that information is flowing correctly. And then if you're looking at connecting to other organizations outside of your own, within the promoting interoperability programs, I mentioned that sending and receiving of health information. So there's two separate objectives that you can attest to. If you do those two separate objectives, you'll have to report how many patients you transitioned out or referred to another provider. And then you're looking at your processes around downloading that summary of care document, how you're sending that electronically to other organizations. So making sure that your methods for doing that are listed. Are you doing it through direct messaging? Are you doing it through a secure email or some other type of HISP? Or if you're connected to a health information exchange and sending it that way. Same thing with when that information is coming back in. So how do you currently pull that information back into your EHR? Does it come in automatically? Do you get a note that you have a continuity of care document and then review the clinical information and see what you want to incorporate into your EHR? Do you have to log into a separate portal, like for, say, a big healthcare system, and pull in information that way? So within these safer guides, you're looking at all of those different processes of how you may connect to other healthcare organizations, and then how you incorporate that information into your EHR or how you send it out, depending on how that's going. Does that answer your question? Okay, great. Thank you. So again, these safer guides are really just looking at all of your internal processes. Some of these probably happen just without you having to do much, or they may be just second nature because they're automated within your EHR system. Some of them, if you're a manager, a chief nursing officer, you may want to do a little bit more digging because you may say, well, I know it's supposed to work in our EHR like this, but I'm not sure exactly who completes that process, or I'm not sure where this happens within that chain of events. So these are really just, again, a self-assessment, making sure that you're reviewing those processes within your EHR and are aware of how that information is captured, how it's shared, and how it can help to maintain the safety of your patients and of your health information.
All right, I'm not seeing any more questions.
Okay, looks like we are at the top of the hour. So again, we just want to thank everybody for joining us. I believe that if you registered for this office hour session, it is a series. So Jamie, correct me if I'm wrong, but I think there are 3 or 4 more series after this. Make sure that you are just checking your emails from OFMQ and My Health, and we'll keep you posted on the future topics that there are. And make sure you tell all your friends and other partner organizations to join us next time as well. Thank you, everyone.